High cholesterol is a common problem affecting about 50% of adults. So when your cholesterol levels are too high, it can lead to serious health issues like heart disease and stroke. Now, many people are prescribed statins, which are medications designed to lower cholesterol. Now, in fact, around 200 million people worldwide take statins each year. However, a lot of people are hesitant to take these drugs due to potential side effects or personal preferences. Now, before I continue with this video, keep in mind cholesterol is not the cause of heart disease or stroke, but for certain individuals, it is ideal to maintain a lower level until we figure out what is causing the issue and or if your lipids are oxidizing. So this is where red yeast rice comes in as a natural alternative. It has been used in traditional Chinese medicine for over 2,000 years, dating back to the Ming Dynasty. Now, back then, it was primarily used as a food coloring agent for dishes like Peking duck and red vinegar. It was also believed to have medicinal properties that could improve heart health. So what exactly is red yeast rice? See, it's a rice that has been fermented with a specific type of yeast called Monascos purpuris. Now, during the fermentation process, the rice turns a deep red color and produces a variety of compounds called monocolins. Now, in 1970, the researchers discovered that one of these monocolins, known as monocolin K, is chemically identical to lovastatin, the active ingredient in the first statin drug developed. But red yeast rice doesn't just contain monocolin K, it has a complex mixture of various monocolins and other substances that actually all work together to lower cholesterol. And this is why taking red yeast rice can be as effective as taking a higher dose of a single statin compound. So let's look at some concrete data to see just how effective red yeast rice can be. See, a comprehensive meta-analysis, which is a study that combines the results of many smaller studies, looked at over 20 clinical trials involving more than 6,000 patients. It found that on average, taking red yeast rice lowered LDL cholesterol by 40 points or 1 millimolar per liter for those outside the USA. So to put that into perspective, let's say your LDL cholesterol is 150, which is considered very, very normal. If you start taking red yeast rice and it lowers your LDL by 40 points, you end up at 110, which is, my opinion, is way too low. That's a significant improvement for some viewers. So when you compare the effects of red yeast rice to prescription statins, the results are quite similar. One large study from China looked at over 4,000 patients with coronary heart disease. Half were given red yeast rice and half were given simvastatin, a common statin drug. And after 4.5 years, both groups had nearly identical reduction in cholesterol levels, coronary events, and overall mortality. Another study by Dr. David Becker at Temple University looked specifically at patients who had to stop taking statins due to muscle pain, which is a common side effect. He gave these patients red yeast rice instead and found that their cholesterol levels decreased significantly over 24 weeks without an increase in muscle symptoms. So, if red yeast rice is so effective, why isn't it more widely used? See, especially in Western countries, there are a few reasons. First, because red yeast rice naturally contains lovastatin. It skirts the line between a supplement and a drug. In the US, the FDA has cracked down on some red yeast rice products for containing too much lovastatin, as supplements aren't allowed to contain pharmaceutical drugs. Second, see, the quality of red yeast rice products can vary significantly because it's a natural product made through fermentation. The amount of active compounds can differ from batch to batch and brand to brand. Some less manufacturers may have products with little to no cholesterol lowering compounds. There's also a potential safety concern with a toxin called citrinin, which can form during the fermentation process if it's not properly controlled. And citrulline can actually cause kidney and liver damage. However, these cases are very rare, and reputable companies generally have 0 levels of citrulline. So to ensure you're getting a high quality, effective, and safe product, it's important to choose red yeast rice from reputable companies. Organizations like Consumer Labs regularly test different brands and of course publish their results. There are multiple brands listed on iHerb with proper certificate of analysis if you are interested as well. So when starting red yeast rice, the typical recommended dose is 1200 milligrams per day, which is usually 2 capsules. Some people may benefit from higher dose up to 3600 milligrams per day. Dr. Clayton mentions that he personally takes 2400 milligrams per day for optimal cholesterol lowering. And it's best to take red yeast rice in the evening because your body naturally produces more cholesterol at night. And by taking it before bed, you can actually maximize its effectiveness. Now, one of the great things about red yeast rice is its affordability. A month's supply typically costs between $15 to $25, which is much cheaper than most prescription statins. So, as with a new supplement, it's always wise to consult your doctor before starting, especially if you have pre-existing health conditions or are taking other medications. While red yeast rice is generally safe, it's not suitable for everyone. For example, because it contains lovastatin, it shouldn't be taken by pregnant women or people with liver disease. In conclusion, red yeast rice is a promising natural alternative for people looking to lower their cholesterol without the use of prescription drugs. It has a long history of use dating back over 2000 years and modern science that has validated its effectiveness. And by choosing a high quality product and taking it regularly at the recommended dosage, you can expect to see a significant reduction in your cholesterol levels, similar to what you might see with a prescription statin. In addition to everything you have just watched, keep in mind, even though you have high cholesterol, ask yourself why. Your body will never produce something in excess unless there is a problem. It is ideal to figure out why this is happening. I would highly advise, if you want to try red yeast rice, don't stop there. Figure out the root cause, as something is happening inside your body. Could it be environmental toxins? Could it be the food you are consuming? Could it be the clothes you are wearing, lotions, creams, toothpastes? There are many things that cause inflammation that are unnatural for our bodies, and all these things will cause LDL cholesterol to oxidize. In addition, grab a pen right now and write this down for your next blood test: HSCRP, LP small a, ApoB, ApoA1, MPO, LPPLA2, homocysteine, fibrinogen, ACR, GFR, AST, ALT, T3, HbA1c1, RBC magnesium not serum, and ox-LDL. And once you get these blood work completed, reach out to me, therefore I can interpret them for you. In the meantime, stay healthy and eat clean.